Hello everyone, this is Dr. Anupriya Goel from Berkowits Hair Skin Clinic, and today we are going to talk about a very important topic, hairline designing. Being a national trainer for dermal fillers and thread lift, aesthetic appearance of the face and face anatomy is my passion, and it is very close to my heart. And I believe hairline designing is a combination of science and art. In any hair transplant, the frontal look of the transplant is the most important, and hence hairline designing is extremely vital and the most important step in the procedure. Other than keeping some important scientific aspects about hairline designing in mind, every hairline is customized according to a patient's face. Now, every hairline design has three major aspects which makes your face look more articulated. First is designing the hairline above the forehead muscle or the frontalis muscle. Second is designing the frontotemporal angles. And third is designing of the temples. Other than the three major aspects, there are various other crucial aspects which also determine the precision of a hairline. First is the angle of the placement of a hair follicle, the number of hair follicles that we implant, the direction of your hair, and also the thickness of the strand of the hair that we implant in specific areas. Now our face is divided into three parts. The upper part exists between the midpoint of the hairline to the glabella, that is the midpoint between the eyebrows. The middle part exists between the glabella to the base of the nose, and the third part is from the base of the nose to the chin. Now these three ratios are ideally about similar, so the placement of the hairline can actually be judged by the exact ratios between these three parts. Secondly, the distance of the hairline from the glabella to the midpoint is about 7 to 10 centimeter in Asians. We try to keep the distance of this hairline for about 7 to 8 centimeter. We try not to go beyond that, otherwise your forehead can look very wide. Third, and the most important, we always try to keep your hairline above the activity of your forehead muscle. So, in some people, the activity of this frontalis muscle is very high. If we place the grafts on this muscle and we formulate your entire hairline and complete your hair transplant, afterwards, what will happen is that whenever you will move this forehead muscle, your hairline will also move along with it, and this will look very bad. So, we make sure that your hairline is always placed above this forehead muscle. Now, we use two instruments at our clinic to formulate your hairline, mainly so that it is symmetrical between the left and the right side. We use a laser hairline device and a measuring scale. Now, with these two instruments, we make sure that the hairline is symmetrical. However, there can be a few millimeters of difference between the left and the right side because in every individual, the curvature of the forehead can vary on both the sides. After determining the activity of your forehead muscle, we place the measuring scale and we measure the distance between the eyebrows towards the base of the hairline. We make sure that it is similar throughout the span of your hairline, and then we confirm it by using the laser hairline device. Now this hairline might look extremely straight to all of you, but while we do the surgery, we make sure that we implant the grafts in a very asymmetrical, irregular way in small mounds so that it looks very natural. The other crucial factors that we have to keep in mind is that we place the grafts at an angle of 15 to 25 degrees. We place single hair follicles in the direction of the hairline, and we place thin hair follicles in the hairline and not very thick ones, so that your hairline looks very natural and gives you a softer look. So while we are picking up the grafts to place them in the hairline, we are very mindful of all these factors so that we give you a very natural and soft look. Now, designing of the temples is another very important aspect of a hair transplant. If you have a receding hairline and if you have receding temples as well, that will make your forehead wider not only vertically but also horizontally, and hence your entire face will look more wider. So, you have to make the temples more sharper to make your forehead smaller. Now, these temples are like small triangles, and their base is parallel to that of the eyebrow. Their distance is about 2.5 to 3 centimeter from the tail of the eyebrow, and the apex of the triangle is very important. because the more forward we make the apex of the triangle of the temples, then the more smaller your forehead will become. And the more farther away we keep the apex of the triangles of these temples, the more wider your forehead will become. Now you can see in this picture of Brad Pitt that the apex of the triangles of the temples are moving towards the center of his forehead, and hence his forehead is looking smaller. However, in this other picture, the apex of the triangles are farther away, and hence the forehead is looking way more wider. So I hope you found this video useful. If you have any queries on hair transplant, you can post your comments below. If you like this video, like the video and subscribe to our channel. If you want to see more videos on skincare, please follow us on Instagram at Dr. Anupriya Goel and at Berkowits Clinic. Stay healthy and stay beautiful. Thank you.